It has taken 3 years of negotiations, but the World Health Organization has announced this week that member states have now come to some sort of key agreement around preparing and responding to future pandemics. Countries have reached an agreement on a draft plan that will be considered at next month's World Health Assembly. Let's get some details now. Primary healthcare physician as well as former South Africa Medical Association Chair, Dr Angelique Coetzee, joining us now. Dr Coetzee, appreciate the time. Better late than never, I suppose. But let's talk about what are some of the concessions that have been made.
Great. So just want a bit of background for our listeners and viewers. In December 2021, at the height of the COVID-19 pandemic, the World Health Organization member states, they established the intergovernmental negotiating body. And I think what is important here is that there's two co-chairs, and South Africa, under the leading of Ms. Precious Matsoso, as well as the ambassador of France and Claire Amprou, were the two co-chairs having these negotiated through this 3 years of negotiating a draft document. And if we look at the draft document, as you have said, it is some of the key highlights is equitable access to health resources. So this agreement proposes that countries sharing critical viral samples will receive a portion of resulting tests, medicines and vaccines, and the World Health Organization would hold up to about 20% of such products to ensure that there's distribution to lower income countries. Also, the strengthening of global health systems. The draft emphasizes the building of geographical diverse research and development capacities, also help with facilitating technology transfer and mobilizing a skilled global health emergency workforce. And then two more points that's of interesting is again, establishing a coordinated financial mechanism. So this mechanism is proposed to enhance transparency, coordination, and accessibility of existing funding sources, particularly for developing countries. We saw what happened during this past. And then the last one is the legal framework. And interesting, this would only be the second legally binding agreement in the WHO history, following the Framework Convention on Tobacco Control. And this treaty is being developed under Article 19 of the WHO Constitution. But there are also challenges and considerations.
This makes it very pertinent and important as well then. And as you made note of, the financial aspect was a big one because it meant access to the vaccines was a difficult one to get through as well. Are those the kind of gaps especially from COVID-19 that this will aim to address?
Yes, for sure, it will. It will definitely address some of those concerns that we have seen, especially on Africa continent. You know, we didn't have or didn't receive all of the vaccines. The first world countries sort of gathered them for themselves and didn't assist in, helping Africa before they have not made sure that their own people has been helped. But as I've said, there's some challenges and considerations that one needs to take into consideration. And one of this is the non-participation of key countries like the United States and Argentina have withdrawn from the WHO, and they are not expected to sign the treaty. And this now raises concerns about the treaty's global effectiveness and the commitment of major powers to international health cooperation. Also, it is a voluntary compliance, so advocacy groups have expressed cautious optimism, also noting that the treaty's reliance on voluntary compliance and the lack of strict enforcement mechanisms. So dispute resolution would involve some of the diplomatic channels and arbitration, and then some pending issues. There are some critical aspects, such as the specifics of the pathogen access and benefit sharing system. That still remains unresolved and are expected to be negotiated further.
This makes it very difficult, though, to then accept that this is going to be a big step in the health sector. I mean, it ultimately that means that there are some people who, of course, will adhere to it. They'll do their absolute best because it mattered a lot more to them. But does this become more of a developing nation story as opposed to it being a first world story? Because they're the ones who, of course, had the, let's call it, nationalism during COVID-19.
Yes, unfortunately, that's correct. We all know about Donald Trump's recent announcement that they're going to break away from the World Health Organization, and it might, as you correctly said, be the developing world's more benefit in signing these treaties. But again, if you sign the treaty, it's legally binding. So let's hope that it aims to institutionalize pandemic preparedness globally, trying to ensure that there's early detection of threats, transparent information sharing, and then also coordinating responses across some of the countries and mutual accountability. So if we look at the COVID-19 pandemic, it showed how fragmented and slow the world's response was. Yeah. And a binding treaty gives us a bit of a common rule book so we can act together, not in panic.
So how do we then measure success when it comes to this agreement? Will we only know when a pandemic then comes through and then we'll ultimately see if this process works?
Yes, unfortunately, once if there's a next pandemic coming on globally, we would then be able to see. And then also those countries that stayed out of the legally binding legal agreements, what will they do? But, again, those who are on board, one can help and see what we can do. So, a treaty like this only works if everyone is unfortunately at the table. And without key players like the US, it is like having a fire drill where half the team stays behind. So it weakens our global safety net. But hopefully, everyone will at some stage come to the table.
So what happens then? You said that it is legally binding. Once you've signed, it is then legally binding. And anybody who then doesn't adhere to it, what are what happens after that? What happens to anybody who then doesn't abide by it but actually signed the treaty?
In terms of the documents that I've went through, it's not really talking about that. And I think they should be, hopefully, in the meeting next month. This will also be, once this has been tabled, we will get clearance on that. But, the treaty would empower the World Health Organization, again, to coordinate international outbreak responses. Again, as we have said, the technology, the global stockpile, and the skilled international emergency workforce, because no country can tackle pandemics alone. So, as I've always said, viruses don't need visas. The only way to stop pandemics is to work across borders, and the World Health Organization is a global platform. We have to do just that. So let's see what happens to those countries not adhering to this or not signing. But unfortunately, we have to work together. And if you're not on board, you might disempower, especially your upcoming countries or your third world countries. They might be disempowered. But then again, we have seen during COVID, Africa did stand together quite well, and we managed to get through this during the pandemic. And actually, we did better if we look at the death rate than most of the first world countries. So let's see what we can do going forward. So the next pandemic, as we have said, isn't a matter of if, but when. So this treaty is the world's way of saying we have learned from the past and we're preparing together, not apart.
So that doesn't necessarily mean the world is ready for the next pandemic, but we're ready to respond to the next pandemic, ultimately, if all of this is agreed to, correct?
Yes, so your global health security starts with global teamwork. No country can face a pandemic alone. And with this agreement, we're actually one step closer to a safer, more unified or more united world going forward. And that should at least make people sleep a bit better at night. There is something done. It's not that we went into this pandemic and nothing was done, and we say, let whatever will be, will be. No, there was hard work in the background, of which Precious Matsopo played a leading role as a co-chair in this. So we salute her for that.
Dr. Angelique Coetzee, thank you so much for the time. Really appreciate it for sharing insights. The World Health Organization, member states ultimately all agreeing to some sort of pandemic response then as well. So being put forward there, the former South African Medical Association chairperson, as well as a primary healthcare physician, Dr. Angelique Coetzee. Appreciate your time this afternoon.